doing. And I'm just going to talk very briefly about the role of groups in healthcare, because through groups, we can use social connectedness as a powerful influence on health. And if we think about how medicine is currently practiced, it's actually an illness service rather than one that makes us healthy. Absence of disease does not mean that we have wellness, both physical and mental. And social relationships are key not only to illness, but to health, and we can make use of that. And if we think about everyone who has got a chronic disease, has the potential to improve their disease through social relationships alone. And we should be thinking how everyone who has got a chronic disease should have the potential to access groups, to be able to learn how to manage their illness and improve their health. It's the love, laughter, and friendship along the way that makes the biggest difference. And we have to remember that this is biological. This isn't just a nice to have. It is hundreds of millions of years of evolution. It is incredibly powerful. And we can transform our health system by making sure that when we think about long-term ill health, that we're connecting people together so they can go on a journey of improving their health together. And our first speaker is James Maskell, and James has got great experience in developing groups. So welcome, James, and I'm going to leave the audience to you, and we will come back and have a conversation when you're finished. But I'm really happy to hear about the great work that you've been doing.
Thank you so much, Julian. It's wonderful to follow you because you've, set me up really well to have this discussion. My name's James Maskell. I'm really grateful to be here. When we chose as my company Heal Community to sponsor this conference, is because we feel that this is the most important conversation happening in healthcare and medicine. I'm not going to tell you that much about me. If you want to learn about me and my history and why I'm doing this, it's a very beautiful episode of Julian's podcast that you can hear, and we just had a great dynamic at that moment. But I want to just start by talking about how we get from where we are to where we're going. And ultimately, as Julian has just shared here, chronic illness, I've been on a journey for 16 years to uncover the cause of health cost explosion. And I grew up in the UK. I studied health economics. I've lived in America for 16 years, and ultimately come to the realization that chronic disease, which represents 90% of all the cost, comes from is biopsychosocial in nature. All chronic illness is biopsychosocial in nature. And that ultimately one of the reasons why drugs, if you look at numbers like number needed to treat, are so ineffective at chronic illness is because you can't solve a biopsychosocial problem with a purely biological intervention, right? We have to operate at the biological, social, environmental, and psychological areas all simultaneously. We have to have a biopsychosocial intervention. And so that was the first, first understanding. Then when you look at what goes into your health, you realize that medical care, we want to change the medical system, yes, but changing medical care is only 20% of the problem. There are health behaviors that we need to work on, and some of those you'll see there. Certainly socioeconomic factors, the so-called, social determinants of health that really come down to poverty in many cases, and then the physical environment. So the solution has to be able to solve all of those problems. And as Julian has set up so eloquently before, high social stress with loneliness as the most obvious example is the biggest driver of all-cause mortality. And if you look at physical inactivity, alcohol, and smoking, these are things that public health, we spend so much money and time educating on. There's so much budget associated with it, and yet loneliness is a bigger driver than all of those. We really need to work to understand it. So that's what got me interested in understanding groups. And about 8 years ago, I first heard from a woman by the name of Dr. Shilpa Saxena, who'd created essentially this one-off group model, combining the power of group visit with an operating system of medicine focused on a lifestyle first root cause approach. And so you can see here on the left, the normal doctor, which is 7 minutes in each of these rooms. And that would be your hour, 8 times 7, 56 minutes. These people all have a lifestyle driven chronic illness that has been exacerbated by lifestyle. And yet, and so you end up spending a few minutes with each of them and not really being able to help any of them because you can't deliver a biopsychosocial intervention. Then on the right-hand side, you see what her first efforts were to build group episodes of care where you would essentially have, a health coach lecturing, providing a lecture, the physician sitting to the side and doing the visits to qualify for medical visits, and it's got a shared medical appointment. But that model provides a number of benefits. If we look at groups and we apply it to the biopsychosocial model, the groups provide value for the individual, so self-efficacy, regulation of emotions, mindfulness, self-monitoring, self-directed behavior, skill or technique acquisition. A lot of reversing chronic illness is about giving the patient skills to be able to, as an example, cook their own anti-inflammatory meals, right? To be able to learn how to deal with their own stress and so forth. But there are also kick-on benefits to interpersonal relationships like social integration, interpersonal learning. And then there are also benefits to the larger organization and to the community itself. And that was proven out at scale in Frome. And so I've been very excited about groups. And I just wanted to share, if you take this group methodology, I've been primarily involved for the last 8 years in recommending a new operating system of care called functional medicine, mainly because the goal of functional medicine is self-efficacy, and it's really health medicine. It's medicine built around health, not medicine built around disease. And over the last few years, you've seen on the left, this was a study in JAMA in 2019 showing that this functional medicine approach generated significantly better outcomes than conventional medicine at the Cleveland Clinic. And then earlier this year on the right, that functional medicine, when delivered in a group, facilitates even better outcomes and lower cost than one-on-one functional medicine. So this is what I've been involved with, and I wrote this book in 2020 called The Community Cure. And I wanted to give this as a gift to everyone who's here. I made an audio book of it. You can buy it on Audible, but you can also download it for free at thecommunitycure.com/audiobook, and maybe someone can put that in the chat. That's my gift to you. Essentially, the goal of the Community Cure was to be able to catalog all the different ways in which groups, this sort of cross-section of groups infused with healthy behaviors, infused with an operating system of empowerment, infused with an operating system of health, of the pillars of health. And ultimately, what I see with my relationship with Julian and what we sort of discovered on the podcast is that he came to understand that by getting everyone in a group, you could solve loneliness and improve health. And then if you just added to that curriculum a little bit of healthy behaviors, it exponentially increased the potential, the potency of the group to really create health. And I sort of came from the other direction, which is I recognized that functional medicine was a really powerful way, an operating system of delivering health, but that ultimately it was not being delivered in an effective or an efficient enough way to make it affordable for the most vulnerable in society. And so that's why we ended up coming together to realize that this combination of group delivered care and and an operating system of care rooted in health behaviors was this new layer of care that was needed to be executed at scale across all health systems if we were to, flatten the curve of healthcare costs and create sustainable healthcare costs. Otherwise, we would bankrupt every major country within my lifetime, and certainly within my children's lifetime. Now, the one thing that I did wrong with this book is that I brought it out in January 2020, when COVID was already circulating, and it turned out that within a couple of months there were no groups operating at all. And I interviewed yesterday actually an addiction specialist who said that the destruction of groups, whether it be Alcoholics Anonymous, Opiates Anonymous, and all other group delivered services in society in early 2020, had horrific outcomes for those people who were dependent on those groups for getting off opiates otherwise. And so, all across America and all across the world, group delivered healthcare just died. And, imagine, just having brought out this book, expecting to spend the next decade evangelizing the healthcare system should start to build this new layer of care between modern medicine and the community in order to create health at scale across whole populations, only to realize that no one's going to be able to be sitting in rooms. And rather than get distracted from that or discouraged, I saw that maybe there was an opportunity here to create something that could facilitate this kind of growth, because ultimately what I also started to realize through advocating for groups for really the last 8 years and working with independent physicians to build groups is that there's a lot of sort of operational risk. There's a lot of you're relying on health systems to sort of operate a completely new paradigm of care, and ultimately that was unlikely. The number of organizations that had followed the Cleveland Clinic's model and built these group models was slow, and it certainly wasn't like taking off because there was a lot of factors that needed to be dealt with if you were doing it in person. And so that sort of led me to start to think about what I've been doing for the last year. And this is the sponsor of this whole conference and why I'm speaking to you here. Ultimately, I recognize that all of these issues stood in the way of running groups: content, team, hiring, delivery, tracking outcomes, patient experience, payment, physical space, software, all these kind of things. And that's what led to Heal Community. So we're super proud to be sponsoring this session here today. But essentially what we've done is created an organization that facilitates harnessing the power of community with virtual groups for really full spectrum adherence, for a root cause approach to foundational health. So this is the solution. Ultimately, we're calling it decentralized community care. The goal is to keep people in their homes and to be able to help them to start to implement healthy behaviors by using prescribable episodes of care delivered virtually by our team in partnership with clinics that bill insurance, Medicare, Medicaid. And this provides revenue for independent clinics, which are hurting as well through the pandemic. And essentially our service is a group coaching behavior change model, if you look at the circle on the right. But certainly the sort of three pillars of that are the core doctor-patient relationship. So this is a medical service. We use specially trained coaches, and we have a customized digital platform. And the reason why we think this is super important is because this can be delivered and executed and grow no matter what variants come along, no matter if we go back into lockdown or otherwise. We have been bringing together communities of people virtually for the last 10 months. And so, we're excited about that, to have a solution that can happen no matter what happens outside. Now, we're using health coaches because we believe that this health coaches, sits sort of on the edge of medicine and peer care. And this was in the New York Times actually last week. We could all use a health coach. And I love this quote from Brene Brown, who says, "One day you will tell your story of how you overcame what you went through, and it will be someone else's survival guide." And literally that quote encapsulates really why we've put health coaches at the center of our model, because they all have reverse their own chronic illness, and have been through so much to be able to provide that right container that is much harder to provide as a physician. So our Heal community facilitates health transformation by providing this full spectrum support. So the three principles that have to be at the center of it all: belonging, trust, and communication. Those are the principles by which it's built on. But every patient who comes into our group, it has a group. They have this 24-week container for transformation, have a personalized care plan. They have guided self-exploration. They have a coaching team. They're connected to the medical clinic. There's an online portal for 24/7 discussion. And we also partner people with what we're calling a progress partner, which is someone who is sort of someone just like them dealing with the same kind of conditions. And ultimately, our goal here is to really go after this middle of the bell curve, right? In society right now, we have like 15% of people who are empowered, have access to care, they're educated, they're healthy and well. You see these people on the right. There are 15% of people who are like in the system, severely chronically ill, typically older, multiple chronic illness. These are the ones that cost a significant amount. They're a good fit for it, but really this middle group, the 70% of Americans, and in UK as well, the same, who are on a journey towards becoming incredibly costly chronic illness patients. They may have pre-chronic illnesses like pre-diabetes, pre-heart disease, pre-autoimmune disease. Some of them are empowered, some of them are disempowered. The beauty of the group model is that it really facilitates groups of people to support each other in becoming empowered. And the way that Dr. Jeffrey Geller defines that in the first chapter of my book is that people who are empowered have the ability to make their own decisions. And ultimately, you can't start a new juicing or yoga regime if you have 3 jobs, 2 kids and no car. And ultimately, we really need to start to deal with those foundational parts of empowerment on the social determinants of health, which is definitely possible in groups and is proven to happen in these kind of groups. And ultimately, the reason why we're building here in the medical system is that ultimately lonely people end up in the medical system, and there's budget already assigned for people in the medical system through Medicare, Medicaid, commercial insurance, the NHS, or otherwise. So this just gives you an idea of what the coaching group is, with live virtual meetings, foundational education, working with people on their health goals. We build on a 6-pillar process for health transformation. So building community and foundations, nutrition, digestion, relax and de-stress, move, sleep, and then toxins and relationship. And we found that in 6 4-week segments, we're able to really get exceptional health outcomes. Now, we're primarily partnering with clinics right now, but I will tell you, as a result of being part of this community already with Julian, we've already started to have conversations with all kinds of groups that recognize that they need their diffuse population to have a way to communicate and work together on healing. And so we're in conversations with organizations that are helping elder people age in place, right? And so if you just take a step back, we're in the middle, we're at the end, hopefully, of this pandemic, who knows? But, if we had had a system at the beginning, this decentralized community care system where groups of people were able to measure their oxygen saturation at home and then be only able to, only given healthcare or virtual visits or otherwise, based on that information, we could have risk stratified so much more effectively. And I think that if we have danger of future pandemics, this decentralized community model is where it needs to be. So if you're interested in finding out more about Heal Community, you can go to healcommunity.com, fill out the form. I'd love to have a conversation with you. Thank you for the opportunity, Julian, to be part of this conference. We believe my goal with Heal Community is that it will be able to meet the demand, and the demand is unfathomably large for social health, and that we can build and execute that demand irrespective of what's happening out in the world. And we're super grateful for the opportunity to connect in here today.
Thank you, James, and thank you for sponsoring the event as well, because we really wanted to make this whole event free so that as many people as possible could benefit from it. And I want to just come back to a point that we had during our discussion in the podcast, which was, I'd mentioned that the presence of diabetes in population level is about 5%, and pre-diabetes is also 5%. So 10% of our population have either got diabetes or pre-diabetes, and James rightly pointed out that 30% have got pre-diabetes, and so that what we can think about is you don't have to be ill to improve your health. That actually health and wellness is not just for people who are unwell, and so that there's a possibility of really thinking about how you might be interested to become well, and doing it in partnership with other people is absolutely key. And one of the really interesting aspects of what James is doing is about making it virtual. Now I think for many of us, we know it's not the same as face to face, but the question is, how do people relate to each other well on a virtual platform? How well does that work?
Very interesting question. I'm very excited to share this, actually, because I agree. I'm part of a men's group. We've met in person every week, and I just knew how powerful being in person is. And when we decided to work virtually, I just knew there would be a certain amount of the energetics that is not deliverable, virtually. However, there are significant benefits also to virtual care, and one of the things that I want to share is just, I think there's this journey. If you look at just psychiatry, right? Psychiatry started with mental hospitals that people were sent to, and then it was done in hospitals that other people went to, not just mental patients. Then it was delivered in psychiatric offices with a nice couch, right? And now it's being delivered virtually. So over time, you've seen that it's moved back towards the environment where your disease has been caused, right? Everyone is actually being treated now in their own environment where the disease has happened, which is their home, right? All of these chronic illnesses are environmental in nature. It's either the food environment, the stress environment. I'm really grateful that you guys are talking about the sort of, the sort of environmental factors that are beyond the controls, particularly people that have been racially subjugated or otherwise. It's an environment that they're living in, and that's driving the illness. One of the beauties of this is that, I can show you right now, my environment. We can go to the kitchen and look at my fridge, right? I can show you what I put on my computer screen to remind me to do the healthy behaviors. The coach can be in my environment. And that's one of the things that we noticed, Julian, is that if you sign up for a weekly group and you go to your doctor's office for a weekly group, you end up with an hour or two of their attention per week, depending on how long the group is. In the virtual environment, you actually end up with their attention ongoing, because although the sessions like this are weekly or monthly, the engagement is 24/7. And so you have people sharing their wins. You have people sending pictures of their food. You have people, being progress partners with each other. And ultimately, it's that peer-to-peer delivery of value that is the most valuable and powerful tool that we have in healthcare, that we use at 0% of its potential.
And do you find that people are building friendships and relationships, and do they end up meeting face to face more than just virtually?
Well, one of the beauties of the model that we're working so far is that we sort of partner with clinics, right? So here, where we launched in Sacramento, we had initially 4 groups, that were started in partnership with one clinic. So at the time, you couldn't meet up, really. We're in California and have some of the strictest rules. But now, all of those people are organizing to go to the farmers market together. If you look at the history of group visits, especially in disempowered populations, they don't stop. right? They continue after the sort of medical part is done. So in Dr. Geller's groups, for instance, what started as a type 2 diabetes group, once the insurance money had run out and actually everyone was on progress to reversing their diabetes, it became a gardening club. It became a salsa dancing club because those people still wanted to meet. They still wanted to do healthy behaviors together. And yet, that they didn't really have diabetes anymore. And so, this is the potential. So yes, they do. Yes, you can build authentic relationships. Yes, the power of community is very much alive and well. One person's journey inspires another. One person's work inspires another. And you sort of get out of this doctor-patient hegemony that is very like patriarchal in nature, that is very focused on old ideas of compliance, and bring us into this new world of nurturing, support, communication, and education.
And so if any of the attendees have some questions, please put it in the Q&A box, and we'll answer what we can. But I wanted just to unpick the business about diabetes and food, because and pre-diabetes and pre-diabetes, which are unhealthy relationship to food, because when you start to think about this and think about how do you start to solve this kind of a problem, then you think, well, okay, you have to decide what you're going to eat, and people's cooking skills may mean that they don't know exactly what to buy. And then you have to think about, you've got to go down the shops, and what's the shops you're going to go to? And often, the farmer's market is actually a great place to go if you've got access to one. If you go down together, because you can sit and have, guess what, tea and not cake if you're pre-diabetic. But anyway, and then you think about, okay, well, what about the preparation of the food? And then you think about, let's sit down and have a meal. Let's put the mobile phones in another room. Let's create a nice environment in which we eat, and let's sit down and have a lovely chat together. We include our children, etc., etc. And then there's the washing up to do, and then you got the kind of whole evening. And in the group setting, then what you have is that love, laughter, and friendship, which you think about the biochemical pathways that happen when the love, laughter, and friendship happen. That's the release of oxytocin, which is, your blood pressure goes down, your cortisol levels, they start to revert to normal with your daily variation. Your hypothalamic pituitary axis gets much better. Your prosocial nervous system, your autonomic nervous system is working better. Your digestion gets better because your parasympathetic nervous system is doing what it does. And on the behavioral level of knowing what to cook, on knowing what's in your fridge, about knowing that what you're doing is you're decreasing the kind of unhealthy food, and you're enjoying the whole thing together, all of it together in a group setting. That's absolutely profound.
Yeah.
And you can do the same with movement. You can do the same with the environment in which you live. You can do the same with sleep, etc., etc. Everything has the potential to involve relationships.
Yeah. Let me give you a couple of, take that on a bit further. I think anything that you do that's healthy, when done in community, makes it, exponentially more healthy. And I completely agree with you. And I want to give you two examples from the book, actually, of this, because these examples that I'm going to talk about now, anyone could go and do. This isn't anything to do with Heal Community. So, Dr. Joel Kahn, he's a cardiologist, a vegan cardiologist in Detroit. He recommended going on a vegan diet to one of his male patients. The male patient didn't know how to cook, hadn't really ever eaten vegetables before. And so they started this thing called the Plant-Based Nutrition Support Group. And they thought it would just be a few lonely men, looking to do it. But certainly very quickly, within 6 months, they had 7,000 people that signed up. And it turned into monthly groups. It turned into all kinds of education. And, they have vegan, gurus fly in every so often. But it's built around people getting together to, learn how to cook healthy vegan meals so they can reverse their heart disease. On the other side of the thinking paradigm with health, there's there's a diet called autoimmune paleo. So people who have autoimmune disease, and especially with digestive issues, they need to really move their diet towards meat and vegetables in sort of a paleo kind of style. And that can be very isolating too. And so you'll see an example in the book of actually groups of people taking over commercial kitchens on, like, let's say a Monday night when the restaurant isn't open, and working together in groups to cook a whole week's worth of food in the AIP style ahead of time, splitting it out into Tupperware and essentially doing all their cooking for a week in an hour and a half. And so, you know, groups of people, once they find each other, there's such efficiency of delivery in that case, because it takes you just as long to make a dish for one person as it does for 30 people, as far as like what has to be cooked and how long. And so I think there's a lot of innovation that happens, and particularly around food. I think there's real potential for anyone to just become a leader in their community. And it's easier than ever before to find like-minded people, because the internet has created, you know, structures and systems and business and websites to find like-minded people in your community.
And so we're nearly done, James, and I think we're if we continue our cooking analogy, we're getting a flavour of all of this. Can you? Sorry about that, folks. But can you, like, to finish off, can you think of perhaps one or two stories of individuals who, you know, their lives have been transformed by participating in these groups, how they might have moved from loneliness, isolation, ill health into a place of health and feeling connected?
Absolutely. I mean, I'm just going to give you examples of, you know, this group that we started here with Heal Community in Sacramento. And actually at the end so we started 4 groups in the beginning of fall last year, and they ended just before Christmas. And we actually invited all the people from all of those groups onto a Zoom to just, you know, share their experience of what went on. And, you know, you have people, like, the most amazing thing I can say about these videos, like, I think we're so, you know, when we think about testimonial videos, we always expect like a supermodel to show up, right? It's like, oh, I'm a product placement endorsement for this process. These were real people, normal people, in some cases, very, you know, disempowered people who, through a process of 12 weeks, the number one thing that they recognized is to what degree health was in their hands, to what degree their own resilience was in their hands. And once they realize that, because that's actually not common knowledge, we've just gone through a whole pandemic, and does the population really understand that our own immune resilience can be improved? Right? Has that message made it out to the average person? Not at all, but it's absolutely true. And so, you know, the foundation is like learning that you are capable. And then it's like, what resources do you need in order to become capable? And if I had the video here, I would show, you know, just testimonial after testimonial of people who, first of all, come to the realization that they can affect their own health, then start to put a plan into action, because when are they ever going to be better supported than they are right now? Right? That's the question that they realize, is that this is the container that they've been waiting for to make the changes that they've been, you know, trying to make possibly for decades. And so then seeing the people realizing it, set goals. Like, when in healthcare do people set goals? We know in business, we got to set SMART goals, but, you know, are doctors sitting with people and setting SMART goals for patients? No. And then to be supported in that journey and validated in that journey, you know, creates this powerful container. So we've been seeing people, you know, reverse an autoimmune medication in 12 weeks that they've been dealing with for 4 years, where every doctor has just said, hey, you know, you just have to keep taking this, you know, autoimmune biological for the rest of your life. Like, the body is incredible and can repair when given the resources and the tools that it needs. And ultimately, when the damage that's being done by our modern environment is taken away.
Right. Thank you so much, James. It's great to even hear about the potential of what we can achieve